Okay, so I've gloved. Which arm do you want to use? So we're going to use this arm. If I use, in this case, it's going to be the patient's left arm. I'm a righty. I want to be able to do all my things from the tray. If I was going to use the other arm, shift over here, I would have to have the tray over here and, well, no. You know what? I would still have the tray to my right because I'm always using my right hand. So the tray is always on the side of whatever hand you're on. Okay, so now, continuing, doing the tourniquet, I start by holding it flat in my hands. I now switch them. Okay. Now the idea, we have to make this tight, right? So I hold this firm in this hand, so I'm not moving this, okay? And I inch up here, okay? Now I'm ready to grasp this to make the cross. Okay, so now I'm stable here. I pull this one up, and now I have it, and now it's tight. Now I pull up a little bit, and I just tuck this underneath. Okay, and I pull it through just enough, and now I let my finger go. Now when I'm done with the blood draw, I flip this out and it goes away. Now I feel around, and you don't have to see the area, you just have to feel where the vein is. This is the critical point in the procedure, okay? So, I felt where I want to go, now I'm going to clean. And you can assemble this beforehand or not. This can stay like this for a good couple of minutes. Quite frankly, for more than a couple of minutes. But, okay, now, G. I'm always holding this by the wing. The bevel is up. And when I go in, I'm not going to go in slowly. I'm going to go in with a quick jab. Okay, so I feel the vein. I'm going to pull down my finger, and much like injecting an anesthetic, my finger is not in the way of the needle. And stick. Okay, and you see the flash of blood there. Now, there's a vacuum here, and there's a needle underneath that rubber stopper, so the blood goes in. That's great. You'll notice, maybe you can come around on the other side, walk around on the other side. You'll see where my finger is. My third finger comes from behind, from underneath. Ideally, my index finger nail is on the patient's skin. Here, okay, look how I'm transferring the tube here. Okay, again. Sometimes, you know, you can do this, or sometimes you can do this. But anyway, if she moves her arm up, my hand is stuck to her arm because my third knuckle, and we can do this after, but my third knuckle is always on her arm, so no matter how she moves. Okay, anyway, I finished taking the blood. You take the tube out first. Then, if I pulled this out, it's going to splash at us. So then I pull this, okay, and that's gone, okay. And now I have a gauze. You put that over the needle, quickly withdraw, and now I'm immediately putting pressure. And you can see that I'm holding it pretty strong. I don't know, you can see my interosseous muscles there working, okay. In the same token, if you'll notice, with this hand, I've already taken it out, I haven't handled it at all, and I just pull this down. Okay, now the safety mechanism is activated. If I'm close to a sharps container, I immediately just toss it, okay? And then you check if they've stopped bleeding, and continue to put pressure to avoid a bruise. And okay, now we're done with the procedure, but just so you'll note here, when I was holding this thing, okay, my third finger, distal DIP knuckle, okay, was firmly stuck to her hand. So I was in, and now and my index finger is touching was stuck to my third finger, and my third finger was stuck to her arm. So now, if you withdraw your arm quickly. See, I can go with her. Go forward. Oh, okay, no matter what, I am with her. We are one unit. So that the needle doesn't jerk and stick anybody. Okay, so that was that. Okay, we're done.